Ever wondered if you're unknowingly taking something that could harm your health? What if I told you that doctors, the very ones who prescribe medications daily, often avoid taking certain pills themselves? Yet these same medications might be sitting right in your medicine cabinet, and you could be taking them without even realizing the risks. The medications you trust to relieve pain, help you sleep, or manage common health issues might actually be damaging your brain, raising your risk of dementia, and leading to other serious health problems. Alarming, right? Today, we're diving into 5 common medications that doctors, with all their expertise, avoid, but you might be using without knowing the potential dangers. Stay tuned, because not only will we reveal what these medications are, but we'll also share natural alternatives to protect your brain and overall health. This could be life-changing for you and your loved ones. Let's get started. Proton pump inhibitors, PPIs. If you've had heartburn or acid reflux, you've probably heard of PPIs. Medications like omeprazole, Prilosec, and esomeprazole, Nexium, are household names. They're great at reducing stomach acid and providing relief. But here's the catch. Long-term PPI use has been linked to cognitive decline and a higher risk of dementia. Long-term use of PPIs can cause nutrient deficiencies, especially in vitamin B12, which is crucial for brain function. They can also disrupt your gut microbiome, leading to inflammation that affects not just your digestion, but your brain as well. One study found that people who used PPIs long-term had a 44% higher risk of developing dementia. Shocking, right? If you've been using them for a while, it's worth asking yourself, is there a better way to manage your reflux? The answer is usually yes. Simple dietary changes, weight loss, and natural remedies like ginger or apple cider vinegar can provide relief without the risks to your brain. Benzodiazepines. Next up are benzodiazepines, or benzos, often prescribed for anxiety, insomnia, and seizures. If you've ever taken Xanax, Valium, or Ativan, you've used a benzo. While these drugs work well short-term, long-term use can damage your brain. Research shows that people who use benzos for extended periods have a higher chance of developing dementia. These medications slow down brain activity, which helps with anxiety or sleep issues temporarily, but over time, they can cause permanent cognitive changes. Your brain becomes dependent on the drug, and without it, cognitive decline can set in faster. If you rely on benzos, don't stop abruptly. Talk to your doctor about slowly tapering off. There are safer ways to manage anxiety or insomnia, like cognitive behavioral therapy or mindfulness techniques. Statins are commonly prescribed to lower cholesterol and reduce heart disease risk. Medications like atorvastatin, Lipitor, and simvastatin, Zocor, are some of the most frequently used in the world. But there's a debate about their long-term effects on brain health. Statins may interfere with cholesterol production in the brain, which is essential for healthy neurons and cognitive function. Some studies suggest a link between long-term statin use and memory problems or dementia. Now, statins aren't bad for everyone. If you're at high risk for heart disease, the benefits might outweigh the risks. However, doctors who aren't at significant heart disease risk often avoid statins. If you're taking statins, discuss the risks with your doctor, especially if you notice any memory issues. A Mediterranean diet and regular exercise can help manage cholesterol naturally. If you've taken ibuprofen for a headache or naproxen for joint pain, you've used NSAIDs. They're some of the most common pain relievers, but long-term use can increase your risk of cardiovascular problems, which can eventually lead to dementia. Prolonged NSAID use can cause high blood pressure, heart attacks, and strokes, reducing blood flow to the brain and increasing the risk of cognitive decline. Doctors usually avoid long-term use and only take them sparingly. Natural anti-inflammatory options like turmeric or omega-3 supplements can help manage pain without the risks. If you must use NSAIDs, do so only for short-term relief. Anticholinergics are used to treat everything from allergies to depression and overactive bladder, but long-term use has been strongly linked to an increased risk of dementia. These medications block acetylcholine, a neurotransmitter crucial for memory and learning. Long-term use can increase dementia risk by up to 50%. Some common examples include antihistamines like diphenhydramine, Benadryl, certain antidepressants like amitriptyline, and bladder medications such as oxybutynin. If you've been taking these long-term, it's time to reconsider. Doctors avoid these medications, especially as they get older, knowing how critical brain health is. Talk to your doctor about safer alternatives. Now that we've uncovered the 5 medications doctors avoid, but you might be taking, Let me ask you, does this information change how you see your medications? Are you thinking about safer, natural ways to manage your health? While medications can be life-saving, they can also come with risks, especially when used long-term without fully understanding the side effects. The medications we've discussed, PPIs, benzodiazepines, statins, NSAIDs, and anticholinergics, are prescribed every day, often without people knowing the full story, but now you do. The key takeaway is to be informed about what you put into your body. It's not about fear, it's about being proactive. Ask questions, do your research, and don't hesitate to explore alternatives with your doctor. If you found this information helpful, hit the like button, share this video with someone who might need to hear this, and don't forget to subscribe for more eye-opening content. Until next time, stay informed, stay healthy, and take control of your well-being.